my guest, welcome back, recognized leader in neurological surgery, Dr. Edward Zampella, MD, specializing in functional, restorative, and stereotactic neurosurgery. He's an expert in the surgical treatment of tumors of the brain, skull base, and spinal cord. He's past president of the medical staff of Overlook Hospital and served on the board of trustees for Atlantic Health System, and he's helped with make ANS the largest neurosurgical group in New Jersey. And I've got so much to touch on with you, but ANS provides such high quality, multi-modality care to patients, and they're among the best in the nation. What support does an ANS offer their patients over other places?
Well, we have as I said, we have a large group of surgeons. We've added physicians who are non-surgical to our staff. We brought Dr. Ugoric, who is our neurocritical care physician, to take care of our patients in the ICU postoperatively. And Dr. Ugoric, I will say to you, has single-handedly raised the postoperative care to a point where a lot of patients who had very difficult courses are now doing extremely well, particularly our vascular patients.
And Dr. Zampella, as a neurosurgeon, your areas of clinical expertise, as I've said, include functional, restorative, and stereotactic neurosurgery, including deep brain stimulation for Parkinson's disease. That's a whole other show, but tell us about that.
Well, patients with actually, to be honest with you, the original treatment for Parkinson's disease was surgical. Okay. Treatment that dates back into the 1950s, where patients underwent procedures to destroy a portion of the brain to get rid of the symptoms associated with the Parkinson's disease, the tremor, the rigidity, and the dyskinesias. And in the 50s and the 60s, the drugs that were developed that essentially pushed surgery out of the realm of patients. No one would have brain surgery willingly if there was a medicine that they could take that would give them the same relief of symptoms. And the medicines were tremendously effective, but they have their own set of side effects. And some patients become resistant to the effect of the medicines. Some patients are not well treated with the medicines. Mm-hmm. So we have a newer technology available to us. DBS stands for deep brain stimulation. And what this involves is the placement of electrodes within specific targets in the brain. We do it using what they call stereotactic techniques, which are very precise localization techniques. We put the wires in, and during the procedure, we're actually monitoring the individual nerve cells speaking. We listen to it on an oscilloscope, we watch it on an oscilloscope, we listen to it on a speaker, and when we find the appropriate pattern, we know we're at the target site, and at that point we implant the wires, and then at a later date, the patients are connected to their stimulator, which is implanted beneath the skin on the chest, kind of like a pacemaker. And like a pacemaker, we pace them out of their symptoms.
This is like opening a whole new world, because it can also change moods, can it?
There is talk about using this for affective disorders. There are procedures that can be done for depression. There's a lot of, the concept of psychosurgery went out of favor because of ethical considerations, but there are tremendous improvements on the horizon using these implantable technologies.
And Dr. Zampella, after being diagnosed with a brain tumor, what should a person look for when choosing a treatment center? And how do they know if their services are covered by their insurance?
Well, the coverage for the insurance, you have to check with your insurance company. And we at ANS although we're not in every plan, we have a long-standing history of trying to work with patients. What they should look for in their physicians: they should make sure that they're going to a place that has an experience in taking care of patients. They have a program where they can have access to multiple specialists, as we talked about. We at Atlantic Health, also at Atlantic Neurosurgical Specialists, also believe that it's very important to support the patients and their families. That's why Dr. Byrell and I developed the partnership of Hope Brain Tumor Center. We have a support group. We meet on the third Thursday of every month in the evening at our offices. We invite patients to come. We have guest speakers. We provide information to those patients. Patients can speak to other families that are going through the same problems that they are. And it's been very well received by our patient population. They're very appreciative of the opportunity to share some of their experiences with each other. Sometimes it's just something that they have to get out. Other times it's something that they've found that's helped their quality of life that they want to pass on to another patient who might be experiencing the same problems. We're very proud of it. It's worked very well, and I think the patients are very appreciative of it.
So what would you say, how important is it to have the right attitude, to have the hope and optimism, and just, as again I say, hanging in by your fingernails and just being determined to get well?
I personally think it's extremely important.
Plus prayer.
Plus prayer, but I encourage all of my patients for as long as they possibly can to return to work. I want them to empower themselves. I don't want them to accept their diagnosis of a brain tumor as something that is inevitable. As Mrs. Labuti said, unacceptable. They really need to do what they can to maintain their quality of life, to do the best that they can, and their physicians should be focused on helping them do that.
And our time, unfortunately, has come to a close, but Dr. Edward Zampella, MD, recognized leader in neurological surgery